Hello, everybody. Happy Thursday, all. Welcome. Welcome, welcome, welcome. This is the very first episode of The More You Know. So the goal for this is to get on and have authentic conversations with some really awesome people and to just let everybody walk away with something you didn't know, which is hence the name, The More You Know. We're going to be talking about food. We're going to be talking about mental health. We're going to be talking about trauma. We're going to be talking about all kinds of great stuff that nobody really wants to talk about, but we're going to talk about it anyway because I like to talk about this stuff. So my next guest today is Dr. James Young. He is a board certified psychiatrist. He is also an Army vet. He specializes in holistic and integrative treatments. He spent 8 years helping soldiers and their families work through trauma. And I am very excited to talk to this gentleman. So without any delays, please welcome Dr. Young.
All right. Hey, how's it going?
James, how are you?
Good. Doing good, sir. Thank you for having me on.
You're very welcome. Thanks for joining me.
It's my pleasure.
James, I guess from my point of view is I am 52 years old. I have a lot of childhood trauma that I've worked through the last couple of years. Wrapped around, not a very good, happy home life, and not wrapped around, not eating well and not being very happy with life and just all around not happy. And so I guess let's talk about how you got started with all of this, and then how do you help people through all of this?
Sure. Yeah, no, that's a wonderful question. Thanks for asking that, Will. Well, so I actually have gone through some childhood trauma myself as well. And I think I was 16 years old when I realized that, I was just not in a really good place at all. Like I was feeling very sad and depressed. And I then experienced some recovery from that. And so when I came out of my depression as a 16-year-old, I was just like, wow, like this is something that really I want to help people with. And around the same time, I watched Patch Adams. I don't know if people know about that movie, but Robin Williams playing this, doctor, and he's giving everything away basically to help people. And that really inspired me. So that led me to go to medical school. And then when I got into medical school, I knew that I could join the Army and actually serve in the Army as a physician, that kind of stuff. So I joined the Army, and then I actually started as a pediatrics resident. So you know how once we finish medical school, you start internship and you kind of specialize, right? I actually started as a pediatrics resident because, I felt like I wanted to help the kids because, like I felt like, well, I experienced a lot of some adverse events as a child myself, and I want to protect the kids. And so that was my thought process. And one time in my second year of residency, I was rotating, we have different rotations throughout the year. I was rotating in an adolescent clinic rotation, which involved both outpatient and inpatient. And one night I was called upon to go see this patient, and she was like 16 years old, a female. So around the same age that I kind of, had my own mental health struggles. And it turns out that she was admitted to the hospital because she had overdosed as a part of her suicide attempt. And so I started to talk to her as a pediatrics resident, making sure her vitals are okay. She's doing well in terms of her, lab work goes, and doing some physical exams. And then I just started talking to her about what happened, right? What made you so sad, or, became so despaired that you would actually, take pills to end your own life. And so I started to talk to her about her home setting, her relationship with her parents, what's going on at school, her hopes and dreams in her future, and how she's been feeling so miserable for the past few months or so. And then that led her to the decision for her to end her own life. And as I was doing that, I was like, man, like this is exactly what I want to do. Like, I just want to help people with their mental health struggles. I mean, yeah, medicine is great. It saves lives. And of course, we got to have, pediatricians and internists and surgeons, but I want to deal with the mind, right? Because if your mind is ill, I mean, what else can you do, right? You can have the healthiest body in the world, but if your mind is ill, you're just going to either neglect your body, and then your body's no longer going to be well, or you're going to waste your life in a way that is not meaningful, that does not accomplish your values and your goals in life. And so I actually decided to like switch residency, which like nobody does. Like, you're not supposed to do that. It's a huge no. But I just felt compelled to switch to psychiatry. And so I went from pediatrics to psychiatry, and then that led me to this journey of just becoming a psychiatrist and wanting to really help people in terms of their struggle with trauma and the related symptoms of like anxiety, the depression, the substance use, the eating stuff like you discussed, just the consequences of not eating well, and a host kinds of stuff. So that's how I got to where I am now.
Wow. I guess we don't realize on a daily basis everything that we do to our bodies and everything that we do to our minds. So let's talk food for a little bit. I know personally that food played a big part in my mental health issues and my journey. I wasn't eating great. I was overweight. I was drinking a case and a half of Diet Coke a day. I was treating my body as my mind was treating my brain and things like that. And if that doesn't make much sense, but which brought me to the point where I was ready to end my life. And I realized that being in the food industry for 30 years, that we go through these motions every day, and we really don't pay attention to what we're putting into our body.
Yeah.
We don't pay attention to what we're drinking. We don't really notice what we're eating. We're just eating, going through the motion.
Yeah.
So, in your expertise, what do you think? How does food play a role in our daily business and life, and how does it produce the people that we are?
Yeah, no, that's a wonderful question. Yeah, so in my practice, when I see patients and I look over the patient data that they fill out, prior to first seeing me, I always look at their age and their gender, and then I also look at their weight. And the weight is actually, it gives me a lot of data. It gives me an insight into the person of who they are. Unfortunately, a lot of people with mental health issues will actually be overweight, or they could be very underweight. And so it's actually hard to find in my practice amongst my patients who are, sort of in that healthy range of weight, right? And the reason is because, food has become a number one medication that people use in order to cope with their trauma, with their stress, with their anxiety, and with their depression. And so, if you're asking the question of like, okay, how does food come into play? It absolutely comes into such a big role, because again, oftentimes food is being abused in a way, right? Or misused. And not because people want to misuse food, but simply because food is, readily accessible, and food does give some temporary relief from our struggles.
Right. I mean, yeah, that makes total sense to me. Because I was an emotional eater. And, even now I find myself, I'm more aware of what I'm doing now than I used to be. Which, when I was an emotional eater, I still didn't eat the best food. I was just eating what I could, or either going through a drive-through.
Yeah.
And you're right. It did give me a few moments of satisfaction,
Hmm.
but then the after effect of it wasn't the greatest.
Yeah, absolutely. And it's not to satisfaction. Some people will tell me that they felt safe with food, meaning like, that's the only thing that they can control, right? So let's say that you grow up in a chaotic home, dysfunctional home where things are just never stable, right? Whether it's the mom and dad using drugs, whether it's you don't know when the dad is going to go off on his, angry outburst and you're going to get beaten up, or whether you don't know when mom's going to have a new boyfriend or something like that, right? Where it's very chaotic, it's unstable. But food seems to give them a very consistent type of reward every single time they ingest food, right? So that becomes a sort of an object of stability in people's lives. And so because again, it's readily accessible, it's relatively cheap. And we'll talk about, I want to talk to you more about, how the ultra processed foods is how it's cheap, readily accessible, and how that itself is its own thing there, and how that impacts our mental health. But because food is so readily accessible and it does give us that a very quick relief, people end up adhering to food, kind of binding themselves into food as a way of bringing stability and having a sense of control over their lives. And that's especially true for anybody who's gone through a lot of traumatic experiences.
Okay, so tell me, what does it do to the body? What does
Yeah, I mean,
do?
yeah, like the ultra processed foods. Yeah. So, I mean, there's been a lot of research on this, and I'm glad that, we are, really intently looking into this more and more. And the research is very strong, and there's no question about it. There's no doubt about it. I mean, we know, right? Or we already know that food, bad food, ultra processed foods cause diabetes, high blood pressure, and so on and on and on, obesity. But in terms of mental health, which has been more relatively newer discoveries on this, the ultra processed foods, and we kind of have to define the term, right? What is the ultra processed foods? So ultra processed foods are the things that, when you're cooking at home, and as chef, like the things that you don't put into your food at home, right? So like we don't put in colors, we don't put in preservatives, we don't put in like, taste enhancers or texturizing agents, that kind of. So we just don't put them in, right, in our kitchen. So the things that you don't put in at home, but the types of foods that we call ultra processed foods will have them, right? And so therefore they'll have a long shelf life. They'll be very stable for a long time, and they'll also actually be very palatable, right? They'll taste good, and they'll also be cheap. And so I've been, think and lastly, and it's very accessible, right? So I'm tripping there, but yeah. So those are what we call ultra processed foods, and so I was looking at this one study. We call it like a meta-analysis. So what that means is that you combine different studies, like smaller studies all together, and then you kind of have a more bigger result that has a bigger implication for the public. So I was looking at this one meta-analysis, and basically in this study, they were looking at, okay, does it really have correlation with anxiety and depression? And as we have all guessed, it absolutely does, right? So the more ultra processed foods that you consume, the more likely that you will develop anxiety and depression.
So what are the most common ultra processed foods?
Yeah, I mean, all the types of fast foods that we see, on a daily basis, when you drive through any kind of American city or town, we see them all the time, right? Whether it's Taco Bell, McDonald's, and Wendy's. But not only those, like, so any sort of snacks, any sort of chips, the cookies, the things that you buy from the grocery stores that that are not fresh, right? Most of them, more likely than not, most often will be the ultra processed foods.
So things like, when in my household, Kraft macaroni and cheese was served quite a bit. Same with with canned soup, condensed soups,
Right.
and bologna sandwiches
Yep.
and grilled cheese sandwiches. That's ultra processed foods.
Yeah, yeah, absolutely. I mean, and you know them better than I for in that regards. I mean, talk about spam, talk about these sausages, like all these canned foods and yeah, so those are. I mean, when you walk into a grocery store these days, unless it's a really health conscious store, and I won't say their name because I don't want to necessarily advertise them here, but I mean, I feel like 80% of the foods that they sell are ultra processed foods.
So let's look at it from this point of view. Things that are the grocery store cooks, like the rotisserie chickens and the all the pre-made meals that you can go in and pick what you want. How does that play in the ultra process area?
Yeah, I think those are a little bit better than, let's say like Lay's or, the chips, or, like sodas. I think they're a little bit better than them because I think they don't have as long of a shelf life as you would think. Because I mean, they have been freshly cooked or, I mean, they may have been, processed in the factory and things like that, but still, I think they have less shelf life.
Mm-hmm.
So that tells me that they're a little bit better, but still probably not the best.
Right. So, do you think that having a balanced diet with some ultra processed in there is okay? Or do you think that the ultra processed needs to be removed from our diets altogether?
Yeah, my opinion is that we should remove as much of ultra processed foods as possible.
Mhm.
So you should go as organic as possible. You should go as natural as possible. But of course, in the world that we live in, that's almost impossible, right?
Right.
So therefore, I think trying to minimize the amount of intake of those like preservatives, the color dyes, and those agents, the texturizing or tasting agents. I think that's the best that we can do at this time. And of course, in terms of what to eat is a whole separate story. That's probably beyond the scope of this talk right now. But yeah, in terms of like just being very conscious about what is in this food that I'm buying, right? So I mean, of course, fundamentally what you can do, the easiest thing you can do is just kind of look at the description, the nutrition facts, and then see what's in it. That's personally what I do, and I think that's actually that has been working out pretty well for me because I get to see really whether there's preservatives in there or not, and if there is, then I just don't buy it. I just don't take it in.
Yeah, that makes real sense, especially in these day and age. So we can't help what the kids are getting in school, and we can't help with what's served in some hospitals. I mean, I walked into the hospital last week, and I was just amazed. You got a Coke machine, you got processed meats, you got all kinds of processed foods, and I was amazed that this place of wellness is serving these things. And
yeah, totally. And that's unfortunate. That's true everywhere. I mean, not just the hospitals but yeah, like you said, especially the hospitals. I mean, the place where, they should serve the good food, right? The nutritious food that does not cause mental illnesses or, diabetes and high blood pressure. Unfortunately, like those are the types of foods that are being served. And so, I'm hoping that, that there will be more greater awareness in this, that and that more fresh foods would be more readily available. But you mentioned a little bit about the kids, what they're eating, and so I was also looking to a study that shows that some kids who are food addicted, they looked into whether how many of them do they actually ingest ultra processed foods, and as we may expect, so kids who eat a lot of the ultra processed foods, they actually become addicted to food. So there has been more diagnosis of food addiction in kids who actually ingest ultra processed foods as well. And so is it that they were addicted to food in the first place, and now they're just like eating ultra processed foods? Or is it that the ultra processed foods themselves cause addiction? So this study, didn't go into that, and I don't know that there's any study that has actually looked into the causality between the two, whether it's in that direction or the other direction, but that still tells us something, right? How now it's not just about obesity and diabetes and mental health symptoms. Now people are getting addicted to some of these things that we're giving to our kids.
So I grew up with, my sister was a type 1 diabetic, and my
Okay.
mother developed diabetes later on in life. But we grew up in a household where there wasn't much sugar items. There was just a lot of high fat items, like constantly mac and cheeses and spaghettis and things like that were not naturally made with the best ingredients.
Yeah.
And I understand that time's an issue when parents are working jobs and they're trying to take care of the kids and put them together, and they don't want to spend 2 hours meal prepping every day. Well, I get that.
Right.
And so I think, from my point of view, as a chef point of view, we need to do a better job in the food community as to make things easier for people to cook. The good foods, the high protein, not so much carbs, not so much sugar, not so much ultra processed as you were talking about, but the organic vegetables and the farm raised chickens and range eggs and all of that kind of thing. We need to do a better job in educating the community that spending maybe 2 hours on a weekly basis and doing meal prep for themselves, and planning a menu and taking it from there. I mean, I understand that mom or dad are running late from work and they're trying to get home and feed the kids and get them off to do the homework and then get them into bed, and life just takes over.
Yeah.
What do you recommend for that type of family, which seems to be pretty active in our communities these days?
Yeah, I think for some people, they may really feel like they have no choice but to do that, whether it's because of financial burdens that they have, or their job obligations will just prevent them from doing so. But if you think about it, I mean, I think Will, you can tell me whether I'm right or wrong on this. But I think cooking actually doesn't take that much time, right? It actually doesn't take as much effort as we actually perceive it to be. And of course, people are tired at the end of the day, so you rather order pizza, or you rather just do a drive-through on a Burger King or things like that. So I think it actually is a lifestyle, and I think the more people are aware of just the harmful effects of food or these ultra processed foods, I think people will be more willing to not continue in that route. But I think it really does come down to a mindset, right? So, okay, do I want to spend extra 15 minutes, 20 minutes cooking and feed my family some healthier options, or do I want to just kind of do the easy route, do what is more easy and just feed my kids the same stuff that I fed them last week, and then possibly risk them with having more ADHD symptoms, having more depressive symptoms down the road, and also them possibly being addicted to some of these stuff. So I think it really comes down to people's individual values, and which I think most parents mean well, and so therefore I think once they become more aware of just the harmful effects of food, which I really do believe that people still don't know. They kind of know, they hear about it here and there on social media, but I mean, the food industry is so strong here in America, right? I mean, they're just big food, industries, and they're not just going to let people like us and what we're saying to be the word of the day. And so I think that a greater awareness will definitely help the meaning well parents to modify and adjust some of their lifestyles.
So is the medical industry asking that question now of what they're eating when they
yeah, absolutely. Yeah. Oh, totally. Yeah, I mean, it's not necessarily like I mean, I never learned in medical school to focus on food, and that's the reality, right? We never really learned about nutrition itself, which I think is unfortunate, because I think a lot of the diseases that we have in America, are preventable, right? And I think number one reason is food, and number two maybe lifestyle and that kind of stuff. But so yeah, we don't really we I didn't really learn about it. We didn't really talk about it. But at least I know I do. I ask people what kind of food they eat. I always kind of counsel them about how you could actually, by changing what you eat and also the amount of exercise you do, how you could really enhance your mood and just the outlook of your mental health. So I do a lot of counseling in terms of like sort of what we call psychoeducation, like, what can you do to improve your mental health? Well, number one, you really need to take out all the preservatives in your foods. You really need to, give your diet a new facelift, and then upgrade that. And because some of the symptoms that you're experiencing right now could be caused by what you're eating. And number two, how much of physical activity are you doing? Because when you do physical activities, it actually releases the same type of neurotransmitters that we, by medication, try to artificially release in the brain. So like things like norepinephrine, serotonin, and dopamine. So all those good neurotransmitters that we need in our brain to feel well, to feel motivated, to be able to focus and concentrate, and to to be able to be productive. So all that same neurotransmitters are released through exercise. And so, I know I'm talking about exercise right now, but I think there's a pretty close correlation between what kind of food you eat and how much physical exercise or activities that you do. That combination of those two, if you can optimize those two, I think most people would probably do pretty well in terms of mental health, and they probably don't need to see me, and they probably don't need to be on any medications or any other extensive treatments.
Do you think food plays a part in people not wanting to be physically active?
Oh yeah, I believe so too. Yeah, I mean, just we talk about like the crash that you get, right? The food coma, and that's real, right? And especially when you consume the ultra processed foods, you are more likely to feel more tired and fatigued afterwards. And that's simply because it's the blood sugar level, right? So when you eat high processed, high, has very high content, sugar content foods, what happens is your blood sugar will peak, right? And it will go up. And then what happens is it crashes down, right? As opposed to if you eat something that is very highly, has a high protein content, and then it has a more of a complex carbohydrate content. So like potatoes, sweet potatoes, whether it's a steak, like fish, like those more like, healthier foods will not do that. It's not going to increase your blood sugar level so high and then let it crash so much that you're going to be knocked out after lunch, right? So the type of you eat will definitely cause or interfere with a normal activities. And number two, they've done a study in Brazil where they looked at the combination of like people eating a lot of ultra processed foods, and also spending a lot of their time in front of the TV. So it's the worst when you do both the ultra processed foods coupled with lack of physical activity. Like
Right.
that combination showed like 4 times greater likelihood of you developing anxiety and insomnia at night. And so they definitely have relationship of affecting one another, but also not doing them together well will also even make things even worse.
There are people out there that I personally know that they think just because they're going to eat a salad and then they douse it in ranch dressing, that's going to make it super healthy. And
Yeah.
I'm sorry to say, but ranch dressing is not the healthiest.
Right. No, it's not.
And then you're going to put it on a healthy salad, so
Mhm.
you're just ruining the nutritional part of that salad that you were going to get, and now
Right.
it's gone.
Yeah.
And I think a lot of people don't realize that they can eat vegetables, but
Hmm.
if you overcook them, or you cook them in a like a canola oil or a peanut oil,
Hmm.
you're just you're removing a lot of the nutrition that you would
Yeah.
get.
Yeah. Absolutely.
You know,
Yeah.
picking an olive oil or a coconut oil for
Hmm.
some, for instance, and learning how to cook with that, or a grass-fed butter.
Hmm.
Um,
Yeah.
Again, you're keeping the nutrition in the plate and in the pan that you're cooking with, because the
Hmm.
last thing, you can sit there and eat all the vegetables you want, but if you cook them poorly and if you overcook them, then you're just defeating the purpose of it all.
Right, absolutely. Yeah, so I think even like, the education on that sort of things, where I mean, I personally, I'm not a really a cook person, so I don't really know all of this until I really looked into it. And so, I mean, my wife is definitely more aware of some of these things and more knowledgeable. And so, like, I love to hear from people like you and make sure that the way that we're cooking, to make sure that we prepare the foods, that we sort of are able to maximize the nutritiousness of them and not lose on that, right? So, and I think that's a really good point as well.
So let's bring this circle again, full circle, and let's talk about, you know, I had a lot of childhood trauma. I
Hmm.
was an abused child. I was not There was not much love in my household. I didn't know when my father was going to dive off the deep end and start beating me.
Mm.
Um, and so I used food as a deterrent,
Hmm.
a feel good type go to thing. And now that I've changed my eating habits, I've done all of this work on the eating part of it,
Hmm.
but yet I was still feeling that anxiety of that childhood trauma. And I'm like, okay, so now what? It's not the total answer, but it got
Hmm.
me partially there, because it made me more aware of what happened in my childhood, which is now playing a big part in my adulthood. Um,
Hmm.
I didn't get a whole lot of social activities as a kid. So now that made me even more um, damaged as an adult to go out and socialize with people.
Yeah.
And yeah, I am an introvert. I don't have a problem saying that, and I sometimes wish I was more extroverted.
Hmm.
But do you? How does one deal with childhood trauma when they're dealing with the diet part? But how has the mindset play a role in
Yeah. So it's the childhood trauma itself is, I would just call it a beast, right? I mean, it's a big, it has big impact on a person's well-being, sense of well-being, and their mental health, and even their physical health. They did a study that basically examined the effect of the number of adverse childhood events, or ACE. It's called an ACE study, and the type of health that people had when they became older. So, if you had, let's say, like two, three, four, ACE events, so that could include like some of the things that you mentioned, whether it's being physical abuse, neglect, or witnessing violence at home, or sexual abuse, things like that, and how that could impact the type of conditions that they could have as an adult. So diabetes, heart disease, high blood pressure, are there chronic conditions, like gastritis, ulcerative colitis, cancer, all those kind of things. And they saw that basically the more number of the ACE events that you have, the greater severity of your physical illnesses. I bring that just to say that the childhood trauma itself has a huge influence upon someone's health, right? And so, but not just the physical health, right? You're talking more about the mental health, and even more so on the mental health. I mean, the physical disease part can be a little elusive, and we may not really know, why you have developed some of these issues
it?
and the conditions, right? But there is a direct causality, or correlation with some of the mental health symptoms that you have, and food, I think, whether it's overeating, binge eating, or, being anorexic, I think that's just that's a tip of the iceberg that we usually do see in the clinical practice if you have childhood trauma. So it's the way that we deal with childhood trauma is that, first of all, number one, the one of the most effective means of treating childhood trauma is therapy. So it's actually not medication. It is not, being admitted to a psychiatric hospital, even though sometimes that might be necessary depending on how stable or unstable they are. But it's really the therapy, and what the therapy does allows is that basically, because you have accumulated events of trauma in your life, and that has happened over 10 years, 20 years, or 30 years, even sometimes, what you do with therapy is that you are starting to slowly unpeel some of that layers of trauma that have been accumulated over time. Right. And so through therapy, so talking to a therapist or even a group therapy, so you start to talk about, some of the traumatic memories that you have. And in that process, you're allowing yourself to not only become more aware of what the trauma has done, but what it means to you, and how it has affected you and the person that you are now. So yeah, it's a big topic. How do we deal with childhood trauma? But it's always better to get started sooner than later, right? So if anybody's listening to this and you have experienced childhood trauma, like Will have mentioned, and I have experienced some of that trauma as well. But if you've never sought help, then I would encourage you to seek help and see, start talking to a therapist, about your trauma and how you think that may be affecting your day-to-day life, whether it's in the form of anxiety or depression or PTSD, or as we've been talking about today, as is today's topic, binge eating, overeating. You feel like you can't control your eating, or you're puking after eating, or you feel you're addicted to certain types of food. So again, all those things, like if you kind of look back, there's usually trauma that is sort of the underpinning cause of those eating habits and symptoms.
Interesting. I guess 10 years ago, these things were not even talked about.
Yeah. Mm-hmm.
And, from a culinary professional point of view, up until my own situation occurred where I became a diabetic, and I spent hours in the grocery store reading labels and understanding what I'm putting into my mouth is, I guess we don't really know until we ask the question, is what I'm eating and what I'm feeling playing a big part in how I live my life? Well, the answer is yes, it is.
Yeah.
So I've been told that, part of childhood trauma is relatable to a PTSD situation. Could that be classified?
Yeah, absolutely. And the typical PTSD, PTSD that we talk about is what I would call it more of a classical PTSD. And I put that word classical in there just because, when we think of PTSD, we usually think of like a war movie scene where a person gets blown up, their body is thrown up in the air and then they come back down and now they're in a shell shock and, everything has slowed down, right? You're kind of in a dissociative mode. We all know that scene, right? So we kind of think of that. I would kind of think of that as what we call the classical PTSD, where you have like, intrusive thoughts about that event. You have flashbacks about that event. Whenever there's a loud noise that goes up, then you're now all of a sudden as if you're taken back to that place when that happened, and you're having nightmares every day. You're so on guard and on edge. You can never go into a public space where there's a lot of people, because you're constantly on edge. You're constantly thinking about, okay, when is the next bomb going to go off? So that's what I would call like a classical PTSD, and that really requires a very life-threatening, very severe event. Whether it can also involve natural disasters or car accidents. That doesn't really involve people, but something that is very so traumatic that has really shocked you. right? And it's now within you and all within your environment. Now, childhood trauma is a little bit different. Now, childhood trauma can also involve some of these very horrific events, because childhood trauma will often involve sexual assault, right? And sexual assault is very traumatic enough to cause some of these symptoms that I just talked about, what belongs to the classical PTSD. However, the childhood trauma, more often than not, it will be a series of events of neglect, of invalidating comments, like critical comments, or just physical disciplines that were done, but that was done a little bit more over the board, and it was more like an abuse, more like maltreatment, rather than loving physical discipline. And then there will be other events of, like, whether being bullied at school, or whether you're being you're not the dad's favorite child, and so you feel rejected, you feel abandoned by your dad. So all those things can actually accumulate in a child's life over the long run, and that can actually accumulate and come to the point where a person would develop what we call a complex PTSD. So that itself can actually become its own PTSD. And again, we call it a complex PTSD because it is complex in that there have been multiple events, and there's not one particular event that is completely responsible for the set of symptoms that you develop as a result of that. So so that's sort of how I would categorize between the classical and then the complex PTSD. And then and so therefore the way that we treat them are two different ways. Okay, so often with the classical PTSD, that's we would definitely need to use some medications to help reduce some of the symptoms that the person is experiencing, and then they may sometimes need to even go to like a residential unit to be able to really do a deep dive into their trauma, because it's so severe and they can't really function. Versus a complex PTSD is people can actually be functional. So you would never really know unless they tell you, right? And we've all known those people, right? I mean, they're high functioning, they're just they're winning in many different ways, and they become a doctor, lawyer, whatever, or chef, or an athlete, right? And they're highly successful and highly functional, and yet they deep inside of themselves, they know that something is deeply wrong, that some wrong has been done, and that they are not as quote unquote normal as they should be.
Right. Because I know from, I can walk into my kitchen at work and I'm, basically the king, and I'm just, I'm all over the place, and I'm talking to everybody and all of this, and we're putting out this fire, that fire, putting out that food, and I'm just all over it. But I walk into a social situation and it's like a complete shutdown. It's like, who am I? And that's what I basically would ask myself sometimes. Who is this person that I'm looking at? Because I'm not the guy that I was 2 hours ago standing in my kitchen putting out a banquet for 500 people. But I was like, you want to know what? In social situations. It was very difficult. And it still is sometimes today. I've done a lot of over work on it. And, I had a couple of situations where I would just walk in and I had to tell myself, I own this situation. And, not letting people's opinions matter to me. Or I really don't care what you think. I am who I am, and I like who I am. But I think a lot of people don't look at it that way.
Right.
They will avoid social situations because it's easy and comfortable for them.
Yeah, absolutely. Yeah. I think what you're getting at is this, Will. So obviously one of the hallmarks of PTSD is avoidance, right? So when something terrible happens to us, the first thing that we do is what? We avoid,
We
right?
avoid that.
We never go to that place
Yeah,
again.
we don't want to talk about it.
Yeah, exactly. Either you don't want to talk about it, or you never want to remember that again, or you never want to be triggered about that again. So whether it's a place where a bar where I went and I got physically assaulted or sexually assaulted, I'll probably never set my foot again in there. Or whether it was a type of whether it was a really bad car accident that I got into, so then I never want to drive again, right? So I'm not going to try to diagnose you here or anything like that. But from your example, I think what I can draw out and apply to all of us is that we all have this avoidance thing, right? That develops within us. It's a conditioning, we would say in a psychological term. So we all get conditioned to avoid things that were so aversive to us or things that were so traumatic to us. So, think about a student who has panic attack every single time on the day that they have to do presentation, they develop a panic attack and they have to stay at home. They can go to school, right? Why? Because maybe a couple years ago when they were doing a presentation in 6th grade, all the kids made fun of them, and even the teacher kind of affirmed that this kiddo should have been made fun of, that they did a terrible job. And so now every single time they have to do a presentation, they develop a panic attack, right? So when we have a very specific environment or setting that we act very differently than how we are, and you have history of trauma, then it's more than likely that you have some kind of a traumatic event that was related to that specific setting where you just don't function normally. So even in your case, you're like the king, in the kitchen, you're basically telling people what to do, and you're able to maneuver your way, and you're able to kind of basically have a command in that setting, right? But as soon as you go into a different setting where you don't necessarily have the full control, right, then it's almost like, oh gosh, I don't want to be here. This is the worst place to be.
Yes, because I remember 5 years ago, I didn't want to be heard. I didn't want to be seen. I would put on these fantastic events at my job, and when it came time to pay, give credit where credit was due, and they would bring me up in front of the people, I just wouldn't go because I would be in the back of the room because I didn't want that acknowledgement.
Yeah.
So I get that, and so it's amazing to me after all of this work that I've done, both on my mindset and my diet, that it's all related.
Yeah,
it is all related.
Mm-hmm.
And I think once people would think about, we are what we eat.
Yeah.
And we think what we eat.
Mm-hmm.
And whether it's the McDonald's or the Chick-fil-A, it's still not great for you.
Mm-hmm.
It does its job, which is feed you, but it doesn't nourish you.
Yeah.
And that's, I think more people need to ask themselves that question.
Mm-hmm.
It's easy to stop at the burrito stand for lunch, but you're going to put a ton of not so good stuff in that burrito, which will ruin the nutrient content of it all. So,
mm-hmm. Mm-hmm.
So as we close out this great conversation, what's in your refrigerator, James?
Oh man, I knew you were going to ask that.
What is in your refrigerator, my good man?
I know, right? So it's like what's in your wallet.
Yeah.
Exactly. Yeah, no, that's a great question. And we, one of the things that we started doing is actually going grocery shopping every 2 to 3 days. And actually my wife started doing that. It wasn't my idea, it was her idea. And the reason why she started doing that is because she knew that, if we want food fresh, right, then if you want fresh ingredients, then you have to, you can't just, go grocery shopping once a week and, just, get all the stuff that you want, because, then either it's going to go stale or the things that you're getting are not fresh. So thankfully, I think we're doing okay. We could always improve, because I mean, I do like to go out and eat, but unfortunately, I mean, as chef, as I just don't know what they're doing in my food. I don't know what they're putting in my food. I'm not the one who prepared it, so I can't say for sure. And so yeah, we could definitely do better, but it's at least it's better than I think where it has been before.
Who does most of the cooking?
Actually, my wife does.
Okay.
Mm-hmm.
Do you enjoy cooking?
I do, actually, especially breakfast. For some reason, I don't know why. I love cooking breakfast. I like to get up early and cook some eggs and some toast and sometimes some bacon, and so yeah, it's great. And maybe I need to learn from you and how to cook some good breakfast for my wife sometimes. And
Anytime.
that would earn me some good points there.
Well, that's good. James, thank you. Any last words? How do people get a hold of you?
Well, so my website is right there. So jamesyoungdo.com. And so, that's my website and people can get a hold of me there. And I mean, we're heading into holiday season and, it's a minefield, right, of sweets and goodies. And so I just hope that, we would stay, from before entering into holiday and then after, that we would all stay in that same number of the pounds, and so hopefully we'll all survive this holiday season well, eat well, and do plenty of exercise and rest and have fun with family and friends but by doing all of that, so that we don't actually overeat or indulge ourselves in some of those highly ultra processed foods. But it was a pleasure getting on this podcast with you, Will, and I love talking about trauma. I love talking about food. So just hopefully the audience got something from this, and look forward to talking to you again.
Yes, sir. Thank you very much, and hang out in the waiting room and we'll keep chatting a little bit.
All right, sounds good.
All right. Well, there you go. Wow, what a powerful conversation that was. Again, the more you know. I think that we need to do a better job as people, monitoring what we're eating, what we're feeding our families. And I know it's hard with everything going on in life, and especially the holiday season is not the most easiest on people, especially those suffering with mental illness and are chronic overeaters. I get that. The temptations are really there, and but you're not alone. I encourage all of you that if you're struggling, reach out. If you can't find a friend of yours to talk to, then reach out to a stranger. You can reach me at the Chef Will W on Instagram. I'll talk to everybody and anybody and give anybody any help. And we're all here to support one another. I would like to give a big shout out to my life coach, Mr. Colin Egglesfield, for helping me better myself. My journey is ongoing, and I know without him, I would be probably not sitting here in front of you today. So a big shout out to him, and I encourage all of you to have difficult conversations with one another. Check in with your family, check in with your friends, and keep going. So I wish all of you a great weekend, and we will see you next Thursday. So have a great day, everybody. We'll talk soon.